Good afternoon, everyone. My name is Brittany Miller, and I'm excited to be back to host this week's Facebook Live series, Here with Families, Here for Families. I'm so excited that my colleague Nannette is here to join us today, and I'll introduce her in a few minutes. But welcome everyone for jumping on. Happy Friday. We're thinking of all of our families and hope you've had a good week. We're grateful that we've been able to offer support. Families have been calling in with special education questions and questions around our state systems and programs for children with disabilities, and our family support team has been busy at work providing support and help to parents. Thank you again for those just jumping on. My name is Brittany, and today we have a special treat. We're going to be talking about the Department of Developmental Disabilities and Arizona Long-Term Care, which DDD and ALTCS, which many of you know those acronyms, and how they work together, because we get so many questions from families on how they work together, what it means, how you can become eligible, and we'll be tackling those questions here in a moment. Again, welcome. I see some people jumping on. I'm grateful that you're here today. As a way of an update for the organization, Raising Special Kids, as I said previously, has been busy at work supporting families per usual. We did have an announcement we wanted to share, however, and we will be posting information in the chat, which, by the way, I am watching. So if questions pop up, or you want to say hi, please feel free to do so in the chat. But we are hosting some listening sessions for the health plans that offer long-term care services for our children, all related to augmentative communication, or AAC, as many of you know what that means. So we want you to participate. The health plans, as many of you know, in 2021 are taking over that department. And so children that need devices and AAC to communicate, they will be utilizing their health plan for that. And so they are gathering information. They want to hear from the families. They want to know what your experiences are, what your concerns are, and suggestions. We're having a session tonight. We'll go ahead and post the flyer in the chat. We're doing two tonight, one at 4 p.m. and one at 7 p.m. And the login information is there. If you register, we will go ahead and send out the Zoom link for you. And we're also doing it again on Tuesday, this coming Tuesday, and we'll be offering it, some of that in Spanish as well for that community. So please join. They want to hear from you. We're going to be participating, and I personally am excited. I'm going through this process for the second time for my daughter, so I can't wait to hear what the health plans have to say and to hear from the families. So let's jump into today's topic. I am so excited to have Nannette here. So Nannette, welcome. Thank you for joining us.
Always. Thanks for having me.
Of course. Nannette Salasek is our Raising Special Kids Healthcare Systems Administrator. So she is the expert on all things healthcare, and she helps train our staff so we can better support you all, the families that we serve. And so welcome. We're so excited to have you here. And I have given Nannette some questions. And again, I'm watching the chat. So if you have them, please listen up, because we have some good questions that we're going to tackle from things we hear all the time from families. You know, families call Raising Special Kids very often, as you know, Nannette, asking about DDD, asking about long-term care, and asking, you know, what services do they offer? How do I apply? And so I have collected some questions and given them to Nannette. And so we're just going to go through those, and she's going to help us understand how this all works. Okay?
Sounds good.
Great. Okay, so the first question I have for you is, what is the Department of Developmental Disabilities? Developmental Disabilities.
It's Friday. It's okay.
What is the Department of Developmental Disabilities and Arizona Long-Term Care, and how do these agencies work together?
Sure. So perfect. So most of us know them by DDD and ALTCS, and we at Raising Special Kids always have to remember not to use the alphabet soup of acronyms, right? Because when families are new to this, they have no idea what those mean. But just for the sake of getting tongue-tied, we'll stick to DDD and ALTCS for now. So they are basically here in Arizona, we have programs that provide medical assistance, medical insurance, and services for children with disabilities. And, I'd like to start off by Envision Access. We all know the acronym Arizona Healthcare Cost Containment System as being like the umbrella, right? And underneath that umbrella, there's different programs. So we have our Access Health Insurance. If you qualify with low income, you can apply for that, nutrition assistance. But we also have programs that are for children that have disabilities, and it's not based on parents' income. So it's solely based on the child's diagnosis and then the child's income or savings. They can't have any savings account that exceeds $2,000 in their name. And so that's what DDD and long-term care are. And basically they're two separate agencies, but they kind of work connected at the hip, right? So we first have to apply for DDD, get our child approved, and then we can move on and apply for long-term care. And that's the big one. That's the one that actually pays for services and provides the help that we need.
Thank you. I know when I work with families, to kind of simplify it, if you think of it, DDD, coordinates the services, you have a support coordinator that supports you, and then long-term care is the payer who helps you or your loved one have those services that you need.
Sure. So many times parents will call us and they'll be like, we made it, we got approved for DDD, we're home free. And I'm like, good, you're just halfway there.
Right.
It's an important step and it's a necessary step, but long-term care is the one that's responsible for paying for services. Correct.
Perfect. Thank you. So what diagnoses are considered for the programs?
So when we've got our little ones can apply for DDD at any age. This is one of the biggest misconceptions out there with families. Sometimes they've heard out in the community that they can't apply until the child is 3 years or older, and that's just not true. If you think about it, think of a little infant that's born with a heart condition that needs emergency heart surgery. That child can certainly apply, for DDD and long-term care immediately, even before they've come home, which is great. So we can apply for our children under the age of 6, just simply being at risk for certain diagnoses. Once our kiddos are 6 years old, then we have to have that formal diagnosis. And DDD spells it out. They explain it on their website exactly what the qualifying diagnoses are and who you have to get that diagnosis from. So the 4 are autism, cerebral palsy, epilepsy, or severe cognitive delay or intellectual disability. And those need to be diagnosed not by our just regular general pediatrician, but it's got to come from a developmental pediatrician, which is basically just a physician who's gone to school a little bit longer, and is an expert in those areas, or a licensed psychologist or a licensed psychiatrist. So they explain that it's got to come from a specialist and not just our regular, general pediatrician.
Sure. And for families listening, if you have questions about this or you want to get your child seen by a developmental pediatrician or a neuropsych or a licensed psychologist, please call our office because we do have a list of resources. We can help you figure out, the ones that take private insurance and the ones that take access. But please reach out to us because we can help you with some suggestions for getting your child evaluated.
Yeah, that's a big concern. A lot of times with parents, they think, I don't even know where to get started. I have this insurance, or my friends keep telling me it's going to be 6 months to a year before I get in. And we can certainly help, explain which physicians you could call to make an appointment. And there's also financial help. So a lot of times folks with private insurance feel like, I don't know what to do, the deductible's too much, and there's actually grants available to help with those medical bills for an evaluation. So definitely call us. We've got tons of resources.
Sounds good. Okay. So I'm going to give you a scenario that we hear often. And it actually happened to me with my own daughter, Brooke, when she was little. So when she was born, she had a diagnosis and she ended up being assessed and eligible for Arizona early intervention, or AZIP, as many families call it. Right. But our social worker in the hospital, was like, hey, she may be eligible for DDD because she had several of the considered diagnoses. So we have families that sometimes get confused with, my kid's in AZIP. Do I need to wait till they're 3? Can I apply for long-term care? Can you kind of walk through that a little bit and help clarify that for the families listening?
Sure. Yeah, I was the same way. When our daughter was born and we were in the NICU, you have so many social workers and, professionals providing you information, and you can't even make sense of your own name at that point, much less any of the information that they're giving you. So you can certainly start with early intervention. That's usually the first agency that we come, in contact with when we have a little one. And then when it comes to DDD, if a parent just tried to apply for DDD with a child under 3 years old, they would send them back to early intervention. So they would say, call ACE at first. So when you've got a kiddo under the age of 3, you do have to start with early intervention. So if parents are like, well, I didn't want to get the services, so I declined them, unfortunately, you got to circle back and start with early intervention. And then they can certainly be really helpful with getting all the child's, documents and information over to DDD, but we can also help you. A parent can do it on their own. You don't need a doctor's prescription. You don't need a therapist to help you. Any parent, or caregiver can go ahead and apply for the child. So if you're an AZIP, start there and then get everything sent over to DDD, and that's the next step. And then once you get qualified for DDD, then the third step would be then applying for long-term care.
Okay, perfect. And about that process, I've had parents ask me a lot about, my child is AZIP eligible, she's getting services from their program. Can they still receive some of the DDD approved services like respite or attendant care? Can those services still be offered even though they're under 3 in that AZIP program?
Yeah. So not attendant care, but respite, definitely. Respite is basically a fancy word for giving us parents a break. It's a paid caregiver. And the great thing is that sometimes it could be a family member. So a lot of times grandma or grandpa will step into that role. And it's somebody that we know, we trust, our child, trust. And so it's usually a good fit that way. And if you don't have family, that's okay. We certainly have so many respite agencies out here in Phoenix, in Arizona, and you could call one, you could interview folks, and then once you feel comfortable, then you could go with someone, and have them provide the respite services.
Thank you. And families, if you have a question, I'm watching the chat, I keep glancing over here. So if you have a question about this and we have time, please post it there because we'd be happy to address it for you. If you have some individual concerns about this, please call Raising Special Kids. We can put our information in the chat, but our number is 602-242-4366. And we'll put our referral link because we can help you walk through this process. We can also connect you, give some suggestions of some agencies like Nannette mentioned that are maybe in your area. So definitely reach out to us. We want to help you. Okay.
Yeah, and Brittany, also I thought of the process is pretty simple. We can provide families the link, and when you go onto the website, and DDD is so good about explaining eligibility and how it works. And so it breaks it down to age ranges. So you would just click on the age range that your child is. So if you've got, 0 to 3, or if you've got 3 to 6, 6 and older, it explains it exactly, what to do, what next steps are. And right now, because of COVID, the interviews are happening over the phone. So we're having virtual visits, whereas in the past, they would actually come to the home to provide the interview.
Thank you. And I think we can put the Department of Developmental Disabilities website in the chat as well. And I agree, it's very user-friendly and pretty easy to navigate and kind of figure out what you need. So families, check it out. And of course, reach out to us if you have questions. So let's keep going with our questions. So can you share, Nannette, a little bit about, the DDD eligibility process and then the ALTCS eligibility process and what they look like?
Sure. So like I mentioned before, our children are eligible no matter what age, right? So there's no age cutoff for when we can apply. And that eligibility, when it comes to the specific diagnoses, we don't need it until the child is 6 years old. But when the child is 6, then we definitely need to have one of the 4 qualifying diagnoses, like we mentioned, autism, CP, epilepsy, or cognitive delay, to continue to qualify for DDD services.
Okay.
And then they're very similar how it works. When you have the DDD caseworker call and ask you all these questions about your child's medical condition, and they ask a lot of age appropriate questions. So developmental milestones, what your child, can do in comparison to a typical child the same age. Long-term care pretty much has the same questionnaire. For long-term care, it's called a PASS tool. And actually the interview at long-term care is twofold. So the first thing is the financial interview. And basically it's over the phone, and they're going to ask you all these questions about your child's finances. Again, nothing to do with parents, which is great. It's one of the best things about long-term care, I think. And
Very
then
good.
the second one will be the medical assessment. So that's where they're going to ask you the past stool of questions. And they're all, like I said, they're all developmentally appropriate questions, but sometimes it's hard. We always tell parents, when you have this phone call and when they call you and ask you all the questions, make sure that you're thinking of your child on a day when they're not feeling well. So on a day, on any given day, when they ask you a question, I don't know, let's say for an example, can your child button their shirt or dress themselves? I have to stop and think, does my daughter do this consistently every single day without fail, without any help or assistance or bribing from mom or dad, right? So it's important to think of that in that situation, because in the moment you just might want to be proud mom or dad, right? And you're thinking, oh, they finally did it for the first time last week. And then you communicate that, the caseworker is not getting an accurate picture of what your child can and cannot do. So it's just not the time to be the proud parent. You got to stop and think on a day when your kiddo is really struggling, and can they do it consistently every single day? And if you think to yourself, no, it doesn't happen every day, then you got to say no.
It's a good point you bring that up, because I remember being emotional, going through that. And, when you're asked this questions of, can your child do this? Can your child do this? And for my daughter, most of it was no. I think I, cried a little bit through that interview, but at the same time, we have very supportive agencies in our state. And because she has these needs, she was able to qualify and get supports and services to help her thrive. And I really attribute on how she's doing today from the support from early intervention and DDD these last 10 years. And I'm sure you can relate with your child too.
And my heart goes out to the parents that call us and they say, oh, my child is not in a wheelchair, or my child speaks, they're not nonverbal. And I'm thinking, that's okay. Mm-hmm. It's not about only disabilities that are visible on the outside. It's about what the child can and cannot do, and if they need those services to be put into place. And that makes me think of another thing too. The verbiage for long-term care is a little outdated, and that's been really difficult for a lot of parents. When you read that it says your child must be at risk for institutionalization, we would never institutionalize any of our children these days, or they must be at risk for not being able to live without nursing services in place, for support. So I always tell folks, don't read so much into that terminology. The idea is that we're trying to guess, in essence, of whether or not our child is going to need supports and services when they're older, if they're at risk for not being able to live independently. And it's hard because you're almost looking into a crystal ball, right? Trying to figure out what the future is going to be like. And there's many children that receive long-term care and go on to live very independent adult lives. So it's always something to keep in mind.
That's very true. And the DDD website, parents, if you're jumping on there, you can download, they have an eligibility checklist, and it kind of shows you the areas that the questions might be related to. And we can also send that to you as well and talk over your questions about that. And I found that parents, it gives them kind of a picture on what the interview process might be for their child when they're initially applying for DDD. So definitely check that out or reach out to us.
Sure.
Okay. Let's move on. So I think we've kind of already answered this, Nannette, but do we need DDD and ALTCS? Do we need them both?
So we do need them both in certain circumstances, right? So again, we always start with DDD, must be approved first by them, and then we can apply for long-term care. However, there's some children that qualify for long-term care services that don't qualify for DDD. So if you think about it, trying to think of diagnoses like cystic fibrosis or spina bifida sometimes, or MS, children that are still very medically involved and need the supports and services, but they don't have that cognitive delay to their diagnosis. So they're pretty much right on track with their peers. So those children often don't qualify for DDD, but they can still apply for long-term care. You contact the long-term care office directly, and you basically inquire about the EPD program, which stands for Elderly Physically Disabled, which is goofy because our kids are not elderly. But once again, just disregard the terminology. It's a great program that the child might qualify for long-term care services despite not having a cognitive component to their diagnosis.
And thank you for bringing that up. I find that many families don't know about EPD. And so if you feel like your child may fall into that category, definitely call ALTCS and call us, and we can help you walk you through that. But many children are receiving long-term care services and all that entails under that program. So if you don't get through DDD for some kiddos, that might be an option too.
Definitely. Yeah. You just never know. Sometimes we've got great support coordinators that do a really good job, of explaining when a child is not eligible for DDD or rolls off, at age 6. And some are really great with letting us know what other options are available. And some are just newer and may not be that experienced and may not be knowledgeable about it.
Okay. Well, that definitely tackled the question that was next on our list. But for the families that find that their children is just DDD eligible and they're denied for ALTCS and maybe appealed and it just doesn't happen, that's the area of eligibility that's appropriate. What does DDD provide, if anything, in that situation?
So DDD coordinates services. So when you're little, child 0 to 3, you're going to get a service coordinator. And then when you're older than 3 years old, it's called a support coordinator. So it's a person that coordinates all the benefits for the child and is supposed to assist the parent, with coordinating the medical care. So, circling back to those folks that have DDD, their child was approved for DDD and they're so excited, but then they went on to apply to long-term care and they were denied. We get this phone call a lot. Folks are like, what do I do? So good news, doesn't matter how many times the child is denied with long-term care, you can always reapply. So it doesn't count against them in any negative way, which is good. We're allowed to reapply every 90 days if we're denied. And sometimes I've seen some families who've applied like 4, 5 times. Whenever you have new medical documentation, perhaps a new diagnosis, a new evaluation, you can go ahead and reapply, with that information. And we're also really good about helping parents understand that there's some little things that you can do to help with that evaluation again when you're having another one. So I always tell parents, getting a letter from the physician encouraging the child to receive services can be really helpful. Even though they have to do that questionnaire, they're not going to just take the doctor's diagnosis and give you long-term care. But it's really good to see a letter, where the doctor is saying, I believe this child can really benefit from receiving services. Another tip that I give folks is if you're super emotional, because I was too, I couldn't stop crying, right? Those early days, you can always ask one of your therapists to be present for the interview. So, and even over the phone, families are able to do this. If your child's been working with a physical therapist, a speech therapist, another professional that could speak to the goals that the child is still working towards and perhaps hasn't reached yet, that can be really helpful. And then, of course, like I talked about, not being super proud in the moment, but thinking if your child can do those things consistently every single day, those are just a few things that can help when you're doing another, evaluation when you've been denied.
Thank you. And I have to say, I have used your guidance on this. And recently I helped a family who got that letter from their physician, and then their child was able to, they were able to apply 90 days later and get approved. So don't give up, families. If you're in that situation, call us. We'll help walk you through it and give you some suggestions for your situation. Because of course, if your child is in need of these services, we want to help you get there for them. So Thank you so much. Okay, so moving on, what happens when a child turns 18? Can they still receive DDD and long-term care services? Is there a redetermination process? What does that look like?
There is. So redetermination happens twice in our child's lifetime. It happens when the kiddo turns 6. And at that point, you do not need to reapply. You just need to provide the documented diagnosis information like we talked about. And then it happens again when our child turns 18, when they become an adult, right? It's a whole new world. When you do redetermination for a young adult who's 18, you do have to reapply. And the reason is because it's no longer going to be based on the parents, right, information. Now the child is an adult, and so therefore their finances does come into play. Okay, so remember when they were little, they probably weren't working, and making money, right? But now as an adult, they may have income that exceeds $2,000. So it's important to go ahead and to do that, the redetermination.
Thank you. Okay, you've given us so many good, helpful tips and really clarified, DDD and long-term care and their roles. I'm so grateful. Thank you for joining us today and going through all of that. And for families listening in, if you need assistance with any of these programs or services, please call us. We want to help you. And so in closing, Nannette, I just wanted to ask you this last question. If a family has concerns about DDD or long-term care for their child, or they need help with their current services, what are some things that they can do?
Sure. So it happens all the time, right? We might have a great support coordinator that's so good communicating with us. And sometimes, there's a large turnover. And so we might get one that we can't get a hold of. We don't know what to do. We always tell parents, certainly try first, email your support coordinator, call them if you have their phone number. And if you don't get through to them, I always encourage parents, call DDD. I always call the 602 number. And I go ahead and say, this is my child's name and date of birth. Can you please give me who my support coordinator is? That information, they're able to give it to you. And then I always ask for the supervisor as well. Because if for some reason I have not been able to reach my support coordinator, I can reach out to the supervisor and see what's going on. All things happen. I mean, there's all sorts of things, Sometimes folks are sick or they're out of work, or perhaps your assigned support coordinator has changed and you just weren't aware of it. It's not about getting anybody in trouble. Usually the supervisors are really great about calling us back and helping us. And that makes me think of another tip. When I call DDD, it used to be in the past that sometimes they would give me a phone number and it wasn't a working number, or the number had changed for the support coordinator and it just wasn't, that information hadn't been changed in the computer system. So now I've learned that I always ask the person on the phone, can you please verify that that's a good number, before I let you go? And they're so happy to do that. They're so helpful. And sometimes it's been like, oh, that wasn't a good number. Let me find out, the correct number to provide you. And it's super helpful for sure.
Thank you. I didn't even think of that one, but yeah, I mean, communication is key for any situation we're in for our children that have medical needs and disabilities, collaborating and communicating with their school team, collaborating and communicating with their DDD and long-term care services. So families, we just hope that you've learned something today. If you have questions about DDD, Department of Developmental Disabilities, or Arizona Long-Term Care, please call us. Every situation is unique. And like Nannette said, there are definitely helpful suggestions and kind of tips we can share with you to get through that process, to help with the application, questions about eligibility. And if your child is denied, we can give you some clarification on what to do there.
Yeah.
So thank you so much, Nannette. It was fun to chat with you today, and thank you for joining us. I really appreciate it.
Of course, always good to chat with you, Brittany. Have a great rest of the day and a good weekend too. And I'm excited about tonight. I'm going to sign on and listen in.
Oh, good. And that actually is perfect to end our Facebook Live on. Don't forget to check out the listening sessions tonight. They are posted on our website and you can register and we will send you that Zoom link. Parent input is important and it's valuable and they want to hear from us. So please join us. We are definitely excited to be involved. And with that, everyone have a wonderful weekend. See you next time.